Dr. Heather, you mentioned that there are some clients that come in and they think they have symptoms of ADHD or they have ADHD, but they actually don't. Can you tell us more about that?
Yes, there's about four what we call imposter, or what we can kind of refer to as imposter profiles that symptomatically, they might actually come in with a diagnosis of ADHD. But when we get down to the brain profiles, that's not what's really going on. So, for example, one of them is kind of they might have paroxysms in the brain, which basically means, and it's a big word, but it basically means the brain has a lot of electrical misfirings, things like that. It's kind of an unstable brain, and when those happen, it can create panic. It can also be like a brain wipe. It's just like I was talking and now it's gone. So when we see that those patterns in the EEG, that may be a refer out to a neurologist to take a look at, because because it's not true ADHD. And you add certain medications to that, you're going to make that worse. But it can have an ADHD symptomatic flavor. But from the client, they think that's what it is, because I was doing this and now it's just like I lost everything, or I just feel really overwhelmed. But that's not really what the core source is. And so we see those, and then we start collaborating with other providers.